Query from Nagpur, Maharashtra again. Inability to decide on correct pricing that should make Pareto principle work and have lot of paying patient flow. The correct way to divide your profit for children's education fund, loan repayment, retirement fund, updation of clinic fund, holiday fund savings. Now, the first question, which it says, inability to decide on correct pricing. Pricing that should make Pareto principle work. So some of you may not know, before the costing thing, in the first lockdown, you can say, just a second, I think that slide is missing. I worked on your practice, how to raise your charges also. I explained that in my workshop also, but that is a portion which I have explained it very well, that you need to raise the charges of your services which are doing more in your practice, which are giving you more returns. I mentioned it in the morning. If you're doing one denture in 2 months, it doesn't make sense to raise the charges of that. But the procedures which are giving you return, for example, it may be a root canal in your case, a crown and bridge in your case, or an implant in your case, raise charges of that. Correct pricing, the only answer is pricing videos. I gave the slides. The next slide is also about that. So gave the links about costing. Previous slides also, the next slide will also have profitable or profitability. You search on the channel and you will find it. So Pareto principle, to make Pareto principle work, you have to do smart scheduling first. That has not to do with your pricing part. Pareto principle says 20% of your patients are going to give you 80% of your income. I'll give you a very simple example. You are in your clinic on a Monday evening with your appointments for Tuesday and Wednesday almost full. Almost full. If not clogged, almost full. Maybe a slot here and there. An old patient walks in. He wants a bridge immediately done. He says, tomorrow I'm busy. I need an appointment for Wednesday morning. Wednesday, you are full. But somehow you feel at 11 o'clock, an oral prophylaxis or an extraction patient is scheduled. What will you do? People will say, थोड़ी सी scaling करके advance लेके उस patient को बीच में adjust कर लेंगे. Pareto principle would say, you reschedule that patient to another slot and adjust this patient in there. This is your 20 category patient who's going to give you 80% of income. Which means if he's going to give you 80% of income, then you need to attend to that patient with priority. An extraction or oral prophylaxis or scaling is not going to give you that return. So you need to be wary of that aspect. So do a smart scheduling, make that shift rather than adjusting the patient in there. What if the extraction turns bloody or surgical? What if the prophylaxis patient comes in 15-20 minutes late? It will lead to nothing but a stress. And the rest of the cycle of the appointments will be disturbed. So if you want to make Pareto principle work, employ smart scheduling. When you are the freshest, peak time, such patients should be scheduled who are going to give you maximum return. And of course, there would be high paying also automatically. The correct way to divide your profit for children's education fund, loan repayment, retirement fund, updation of clinic, holiday fund savings. So there are different instruments for different purposes. The first thing is when you have a loan kind of a situation in your hand, the immediate golden rule is to firstly not follow the universal formula of 50-30-20. As I detailed in the morning, the alternate formula, the Bhavdeep formula of 45-15-40 to be resorted to, which means the needs can't be covered by much, but the wants can be. In any case, they say, the golden rule says, your loans should not be crossing 35-40% of your net income. 35-40% of your net income, they should not be crossing. But if you are resorting to 50-30-20, you already have a margin of 20% only in your retirement. Because once you have too many loans, what will happen? Too many loans mean that you need to compromise on your investments to pay the EMI. So you won't have the investments in there, which means you're compromising on your future. Remember the Randhir and Sudhir example. If you are delaying those things, then you need to do, because loan is a very vicious trap. You take one, before that is finished, you already have another loan in mind. One never gets out of it. One of my friend's father used to say this thing very fondly. Beta tu kamayega or bank khayega. You are earning and the bank is earning out of your income. You need to know very, very clearly that loans are not going to help. Now, Children's Education Fund, I believe that is a higher education expense, which is on the higher side. The rest of the expenses we can do from our current income. I explained this in the morning. Loan repayment, I've given you the upper limit. Does not mean that you have to always go to 35 to 40. Stay much below that. Retirement fund, loan repayment and retirement fund usually don't go hand in hand. You can do either of the two. Because if you have more money, then you don't need a loan. If you have less money, then you can either pay a loan or get your retirement. So think about it. What is your choice? Updation of clinic fund. I explained it in the TWCGO formula in the morning. 10% of your you can say income should go in back into operation to keep for any kind of upgrade. Operations does not mean always buying a new machine. It can be for your interior renovation also. It can be for paint also. It can be for changing the decor also. It can be multiple. It is putting the money back into the business. It means that putting the money back into operations or putting the money back into the business. Holiday fund savings, wants. You can curb your current wants to save for your future holiday. See, loan, wants, retirement usually don't, it is like they don't come in one line all add together. This is the first time I'm getting all these in one line, but yes, everything is a learning curve for me also many a times. So I hope you get the answer. Either compromise on your loan or compromise on retirement or compromise on your holiday. If you are not compromising anything, then you are burning something somewhere. Told you an example of profitable already or expenses already.